Hi, I'm Dr. Ashley Mack, owner of Ashley Mack Performance and Rehab. And today I'm going to talk to you about how tibial rotation plays a part when it comes to knee pain. Now, when it comes to knee pain, a lot of patients that I do see have a tendency to have really strong quads, maybe really tight hamstrings or really weak hamstrings, might also have really tight calves. But another aspect of the evaluation is incorporating and assessing how the tibia actually rotates. Now, when it comes to general movements of the knee, you have two very large motions, which is flexion and extension. But then you also have what is called tibial internal rotation and external rotation. The tibia is actually your shin bone, and it moves on your femur. And so tibial and external rotation does have an impact when it comes to the small motions that we do when we're walking, running, and even squatting. So a way that you can assess this is the following. You're going to take a seat on the floor and you're going to stabilize your foot, and then from here we're going to assess external rotation first. Once your foot is at a 90-degree angle, or once your knee is at a 90-degree angle, you're going to stabilize your leg, you're going to turn your foot out. You're going to look over and see where is your thigh bone, where's your femur in relation to your tibia. Usually it's about 30 degrees, which should be an okay range of motion. You're going to go ahead and stand back. Usually this position is really not that painful. The next motion is going to be the following, tibial internal rotation. And you're going to go ahead and grab that foot and you're going to turn your foot in. You want to make sure that your foot is stable on the floor so that way there's no excessive motion at the level of the ankle. From here, you're still going to look down. In some cases, it might be 10, 15, 20 degrees. But if you notice that you are unable to actually turn that foot, or if you notice that there's a big difference between the left and the right side, that could also have a huge impact when it comes to the pain that you're experiencing in your knee when it comes to motions such as walking, running, standing, and even squatting too. Now, if you notice that you are limited in tibial internal rotation, you can then implement this technique, which I find to be very, very helpful when it comes to incorporating that new motion. And it's going to be done in a split squat position. So with the split squat, the idea is the following. You want to be in a position where your feet are about shoulders width apart, so you have a stable base. You're going to have one foot forward and the other foot back. As you bring your knee down to the floor, you should make it so that the shin is actually straight up and down and it's vertical, and the knee is directly over the foot. Now, if your foot is too close, what ends up happening is that knee comes forward, and that kind of defeats the purpose of what we're trying to do, which is add a little bit of rotation. So make sure that you do have an even stance. Now, once you find your stance, you then turn your foot in a little bit. And when you turn your foot in a little bit, it actually incorporates that tibial internal rotation. And we put it under load, allowing it to move in a non-threatening manner. Okay, so you're going to go knee down to the floor and then standing back up, making sure that the knee stays straight forward. And that will actually facilitate a little bit of that tibial internal rotation. I would say start off between 5 to 10 repetitions. And really the idea is to incorporate that new motion. We're not trying to strengthen any sort of muscles. We're just trying to tell the body that it's okay to move in that direction. And people who are usually limited in tibial internal rotation are usually people who have a tendency to stand out this way. Because as you can see, with my feet turned out, my legs have to accommodate by actually having my femurs turned a little bit, and my tibias actually have to rotate out. Now, it's a super weird and super kind of abstract concept, but this is something that I found to be super effective. And so again, get into that lunge position, do a couple split squats, maybe 5 to 10 repetitions, and if it feels great, awesome. Knees are somewhat complicated, so in some cases it can take an easy fix, and in some cases they don't. So if you're doing any of these videos, or if you're doing any of these techniques in these videos that I've been posting, and they're not really super effective, then the next step would be to actually go on and click on the link below so you can actually book a consultation call with me so we can help you out. Take care.